Well, good afternoon, everyone. Sorry for the delay here, but I think we're ready to go. Um, as I think most of you know, the NCR-CRD is hosting this opioid programming webinar series. So I'm the director of the North Central Regional Center for Rural Development, but I'm also serving as the coordinator for the Extension Opioid Crisis Response Group. And so part of our goal is to try to make information available about existing programs that are being used around the country so that others might be able to find a good match for their needs and adopt what they need. And so we've had 3 webinars, one last week, 2 yesterday, and then today we have 2 as well. And the first is Jamie Delafield from the Ohio State University, and she's going to be talking about the mental health first aid program. And then in just a little while at 2 o'clock, we have John Leatherman from Kansas State University doing community assessment to promote behavioral health and planning. And so stay tuned for that. We have one more seminar or webinar on Friday. I'm going to turn this over to Jamie in just a moment. Before I do that, near the end of the webinar, I'm going to pull in this link here, and you can go and provide feedback. And this is intended to help people sort of understand the nature of the program being offered. And so if you click on that, you'll be able to provide feedback, and we really appreciate that. Thanks to everyone who's joining us. And so Jamie Delafield is an extension educator in family consumer sciences at The Ohio State University and also a member of the opioid work group. So Jamie, it's all yours. I will say one other thing. I see some of you have already put in comments in the chat section. If you have some questions for Jamie, you can just type it in there. So with that, thanks for coming on, Jamie. It's all yours.
Thanks, thank you. Can everyone hear me all right? I would also like to introduce my colleague Amanda Rains. She is our 4-H educator here in Hardin County with Ohio State University, and both of us are nationally certified mental health first aid instructors in both the adult course and the course that's called Youth Mental Health First Aid, which is for adults that are working with youth. So she'll be speaking as well and helping me monitor the chat box. So we're going to go ahead and we're going to get started with telling you about mental health first aid.
So we know that in the United States, 1 in every 4 to 5 American adults, depending on which statistic and which government agency you look at, 1 in every 4 or 5 is diagnosed with a mental health disorder. And many of the other people that we are working around and working with are experiencing a mental health disorder that goes undiagnosed due to lots of different reasons like stigma and access to services. These are all things that you've probably heard over and over again. But we know that as an extension professional, you're working in an environment where you're working with people. So chances are you're going to be encountering someone who is living with and coping with a mental health disorder sometime during your work week.
When we think about mental health disorders, we want to acknowledge that depression and anxiety disorders are the most prevalent types of mental illness. There are generalized depression, bipolar disorder, post-traumatic stress disorder, phobic disorders, and obsessive compulsive disorders.
And it's also important to realize that some of the disorders that you may see or hear about frequently in our media and in our pop culture, like schizophrenia and bipolar disorder, while they are very severe and they can impact your abilities, they're not as prevalent as depression and anxiety among Americans.
When we think about our response to the opioid epidemic and the crisis that we have in the United States, we want to make sure that we're reminding people that no matter where we stand on an issue, substance abuse disorder is classified by the American Psychological Association as a mental illness. So substance use disorder is characterized by the dependence of alcohol or any other drug. It's co-occurs with about 30% of other mental health disorders because many people self-medicate, and we want to make sure that regardless of our personal beliefs and no matter what we think, this is a problem because mental illness is a brain disorder. It's an illness of the mind. When we are abusing substances, the chemistry of our brain changes. Therefore, it's important for us to understand and to be advocates in letting people know that there is help, there is recovery, and there is something that we can do.
And just like someone who may have smoked all of their life and developed lung cancer, while we might think in our minds, wow, you brought that on yourself, that's probably not something you're going to say to a lung cancer patient's face. So making sure that we are withholding our judgment with people who are dealing with substance abuse and substance use, and focusing on the fact that they're a person that has a family, a person that has potential to do a lot of great things in our community, and potential to recover.
So no matter what your role with Extension is, we know that you will interact with somebody who is living with a mental illness, whether it be a student, your coworkers, clients, family, friends, community members. As a living, breathing human being, working and serving others, you know someone, and probably everyone, if I asked, you could name somebody and who is struggling with depression, anxiety, bipolar disorder, substance abuse disorder. And we have a response to that. And there is something that you can do to make yourself more comfortable and more aware of what is happening and how you can help.
So we know that research shows that with diagnosis and treatment, those who live with a mental illness can recover and live healthy, fulfilling lives and succeed in living, laughing, and loving every day. So by knowing and talking about mental health, we can be part of the recovery process as extension professionals, and we can help break that stigma. We're already a trusted source of quality, research-based, evidence-based information. So there's no reason that we can't also be talking to our clients about mental health because they already trust us, and refer them to professionals who work in the mental health field that can help with diagnosing or self-help strategies and other things like that.
What's really important is that we do not need to be the experts as extension professionals. We need to be willing to listen, to support, and to refer. So one of the things that's really wonderful about mental health first aid is it helps bring your attention to the community professionals that you are already working with. We all are aware, especially those of us in family and consumer sciences, we're aware of who our dietitians are. We have lots of partners within the health industry. Our 4-H educators have lots of community partners, our AG&R educators as well, and our community development people. We're all working hand in hand in the communities that we live in. And it's really important that we continue to build those relationships and include the mental health professionals in our community in the conversation as well. Just as we would encourage people to seek medical help for respiratory issues, for allergies, for any physical illness, we would also want to refer them out if they need medical help for a mental illness.
And it's also important to remember, even if you aren't currently connected with people in your community who are mental health clinicians or mental health professionals, a great place for anyone to start is their primary care provider, because not only are they aware of mental health issues, they can diagnose them, and they can also help rule out any physical diagnoses that could be impacting mental health as well. So, mental health first aid is an 8-hour certification course. It's similar to CPR and basic first aid in that it teaches you how to help someone experiencing a mental health problem or crisis, but it does not make you a mental health clinician. You will not be able to diagnose anyone. You will not be able to say with certainty that someone has a specific mental health disorder, but you will be familiarized with the signs and symptoms and equipped with the tools to have conversations with them that are impactful to de-escalate situations of crisis and to bridge that gap between when a crisis happens and getting professional help. Sometimes that's a short gap, and sometimes that is a longer process. And mental health first aid helps you identify tools that will be helpful for you as someone who is assisting a friend, a family member, a coworker, or someone in your program.
Like we mentioned earlier, there are 2 certification courses: Mental Health First Aid for Adults, which focuses on each specific diagnosis and how to acknowledge and to identify signs and symptoms for each of those, and then also how to assist. And then there is a Mental Health First Aid for Youth, which is for adults who are working with young people, and this focuses on identifying developing mental health problems versus typical adolescence. So we talk a lot in that course about what is typical adolescent behavior and what are the warning signs beyond that.
So in both of these courses, it's 8 hours, but it is not just somebody talking at you in the course. It's a lot of practicing different activities, practicing different conversations, scenarios, role playing, some artistic type challenges. There's a lot of group work that happens in the course. And one of the great things that the National Council for Behavioral Health, which is the entity that facilitates the training and trains instructors for this, they realize that there are certain groups that need more specific training, and so they have given us supplements as instructors that change some of the different scenarios and some of the different activities to be more focused on specific occupations or specific areas and problems. So there's a supplement for law enforcement, there's a supplement for people who are working with veterans and family members of veterans. There's a supplement for higher education, and there's also a supplement for rural areas, and then an opioid response supplement as well.
So the National Council on Behavioral Health has issued this statement in response to the opioid crisis, and there is a supplement that is now available that can be added to any of the adult courses. And it states that opioids are one of the most significant substance use concerns in the United States. Every day, more than 140 Americans die from a drug overdose. 91 are specifically due to opioids. If this epidemic remains unchecked, it has the potential to claim 1 million lives by 2020. Mental Health First Aid's opioid response supplement teaches people how to recognize and respond to risk factors and the signs and symptoms of an opioid overdose. They also learn how to administer the life-saving opioid overdose antidote, naloxone.
So as an instructor, the person who is providing the course for you, which is certified by the National Council of Behavioral Health, they will be able to enhance your adult course and learn about the clinical foundation of the supplement and of the materials, and they'll have the research in the background. But it also teaches the history of the opioid epidemic, how to recognize signs and symptoms of an overdose, step-by-step instructions on how to use Narcan or naloxone, and then it gives a background context and the statistics for opioid misuse, and it really helps with developing conversation pieces and having impactful discussion about the concerns around the opioid crisis, instead of just saying, you know, this is a problem that we have, but actually learning how to talk with someone who is experiencing substance use, and learning how to apply the Algae Action Plan, which we'll talk about in a second, to someone who may be suffering with addiction.
It also, again, identifies and helps you as an individual taking the course helps you to identify the community partners who are already engaged in this work, and helps you to understand more the statistics and the actual problems for your community. We live in a very rural community here in Northwest Ohio, and one of the things that we have found is that with the way that some statistics are done, we have individuals who are living with an opioid addiction, but because they do not always receive treatment at our local hospital and our local facility, sometimes we're not aware of what is actually happening. So with this supplement, we are working with law enforcement in our community and also with our health department to help make all of us in the community aware of all of the resources that are actually available, which is really important whether you're in an urban area or a rural area.
So the mental health first aid course originated in Australia, and it was brought to the United States in 2008. Worldwide, over 24 different countries and government entities use mental health first aid. And in both of the courses, the adult and the youth course, you learn the ALGAE method. And that's a mnemonic device that helps you remember the steps to providing mental health first aid to someone who is in crisis or to someone who's not in crisis but living with a mental health problem that is developing. So, and you can see at the top, that's ALGAE the koala. He's the little mascot for mental health first aid, and we use him a lot in our course as well.
So we're going to just talk you through the ALGAE method and what you will learn in a mental health first aid 8-hour certification course. Just as a reminder, the certification is one that is good for 3 years. Just like first aid and CPR, you need to refresh your skills after a certain period of time. So the A stands for assess for risk of suicide or harm. This includes harm to self or to others. And if you ever feel that a situation that you're in puts anyone in immediate danger, do not hesitate to call 911.
The second step for L is listen non-judgmentally. The course teaches you and allows you to practice how to listen for understanding instead of response. And it also helps us to identify statements that could be helpful and non-judgmental. And we spend a lot of time in the class practicing leaving our beliefs or our ideas at the door and really responding in conversations for understanding and to give reassurance that you are listening instead of trying to think about what you're going to say in response to some of the things that you may be told.
The G stands for give reassurance and information. As we learn more about mental illness, each one of us becomes more confident in assuring others that they're not alone and that recovery is possible. It also helps us, like we've said, to identify our community supports and national hotlines. For example, at any time, if anyone is in a mental health crisis or a situation where they feel that they need to talk to someone, you can text the word help to 741-741 and you will be connected immediately with a licensed counselor. This is a number that's important for everyone, and for those of us that work with teenagers, or in my case have teenagers living in our house, letting them know that there is always somebody available to them is a wonderful resource.
The first E stands for encourage appropriate professional help, and one of the key words there is appropriate. So it's going to help us identify resources at the local, regional, and national levels that are going to be beneficial to help someone who's dealing with a mental health problem or a mental health crisis. And it's important to know that as a mental health first aider, you're the bridge to professional help, but you are not the professional help yourself. So it is really important in each course that we go over several times what local professional care looks like in your community.
And the last E is that we want to encourage self-help and other support strategies. So different things like that would be exercise, peer support groups, meditation, personal research, spiritual pursuits. And it's really important that as a mental health first aider, we encourage others to help themselves. We can help in many, many ways. But until an individual who is living with mental illness decides that they are ready to battle the disease that they are living with, there's not a lot that we can do other than continue to be a support for them. But by encouraging self-help strategies, we can really change the quality of life for an individual who's living with mental illness.
So mental health first aid is, like we said before, administered by the National Council on Behavioral Health. Jamie and I are both certified instructors for both courses, but we cannot take credit for the program in any way, shape, or form. We just have received the training and become instructors. At Ohio State, we have 6 people in Extension that are on a team that are certified to help provide mental health first aid to Extension clientele across the state. But we are not the only ones in Ohio who are certified. So there's many different agencies across the nation that send their staff to be trained to give this course. So chances are, no matter where you are in the country, there's a course happening near you. And I want to take a second to show you how you can find out what courses are near you and what instructors are near you. So the website is very easy to remember. It's mentalhealthfirstaid.org. And when you go to that website, what you're looking at now is the Take a Course section of the website. And there's a place off to the right that you'll see circled that says Find a Course. And that's what you'll click on to determine what course you want to take and where you want to take it. It will let you put in a zip code or a city name, and then it will also let you choose how many miles you're willing to travel. So I could put in Kenton, Ohio, where our office is located, and say I'm willing to travel 50 miles, or I'm willing to travel 100 miles to take the course. And then it will show you all of the courses that are available to you in that area. And they will be marked either A for adult or Y for youth.
The other thing, as you're searching for a course, you also have the opportunity to see instructors in your area or near you that you can contact. Course price varies depending on the instructor and depending on grants that are available. So courses are anywhere from $0, I think I've seen up to $80 to cover the instructor costs. So it's very affordable depending on your area and what you are able to budget with each instructor.
And depending on what profession and professional organizations you're in, the course is certified by several different professional organizations for continuing education credits, if that is something that is important to you. If you have a degree in social work or something like that and are working with Extension.
So finally, just a reminder that if you are able to take a course, you will have a 3-year certification in mental health first aid. You will be considered a mental health first aider. Every person who takes a course leaves with a mental health first aid manual, which provides an immense amount of information from the National Council on Behavioral Health. It is one of the most amazing resources that we have seen available for how to help an individual who is living with mental illness.
And both of the manuals, the adult manual and the youth training manual, have an entire section devoted to substance use and abuse, and they both include a vast amount of resources that you can contact to be put in touch with local clinicians and research and connect with people in your community as well.
And finally, feel free to contact Amanda or I to get more information on how you can host a course. We can be found through the NCRCRD. Mark and Rosa have our contact information, or we'll enter it in the chat box below. But mainly we just want to let you all know that if you're having trouble navigating the website, we are more than happy to help walk you through finding an instructor in your area or helping you locate a course near you. And like Amanda said, it's sponsored by the National Council for Behavioral Health. There are trainers in all 50 states. So finding a course should not be difficult. And we have found that our local trainers who are not part of Extension are very excited when they hear that Extension is wanting to become a part of this, because we, like Amanda said earlier, we're a trusted agency, we're a trusted organization that people know want what is best for them. And because of that, we have been able in our small rural community to bring the mental health first aid training to organizations that our mental health boards have not been able to, simply because we have a different audience that we typically reach. And we know that you all do too. So if you would host a training, after you attend one, you'll see a wonderful community response. Are there any questions? What is the cost and process to become a trainer? So a training course, it's a 40-hour certification. So you, for a week, would go to whatever location you are able to go to. The initial cost is $2,000. That is before any travel or any hotel stay. They do provide breakfast and lunch as part of that $2,000. You do receive a certification that does not expire as long as you offer the mental health first aid course at least 3 times in a 12-month period, which is more than easy to attain. Amanda and I have 4 courses in the next 2 weeks that we are offering. So once you receive your first certification, the second certification is $950, and it's a 3-day training, and they consider that expedited.
And for more information on that, if you go back to mentalhealthfirstaid.org, right next to the Take a Course tab at the top, there's Be an Instructor. And if you click on that, it will give you details about how to apply to become an instructor, because there is an application and they have to find that you work with an entity that would be good for producing
And
this
support
course.
you.
And then it also gives training dates and locations as well on that website.
Great question, Allison. Thank you. Anyone else?
This is Mark. Just another related question is, when you, let's say you have a training that you get trained, and then you're going to administer an 8-hour session, or break it up to 2 4-hour sessions, is there a cost associated with any materials, etc., for when you step out and start the training?
So when you go to that instructor certification course that's 40 hours, they provide you with everything that you will need for the course. You'll get an instructor manual that gives you way more detail than any other teaching resource I've seen about how to administer the activities and what exactly to say, what questions are common during this section of the course, and how should you answer those. The only thing that is not provided is the participant manuals that everyone gets to take home, and those are built into the cost of the course. So when we have people register for our courses, we charge the $25 for the manual. That way they're paying for the book that they take home, and that's the only extra cost really, besides copies of a couple of different papers.
Right, so there are copies, and then flip charts and markers, things that most of us have around our office anyway. And we at Ohio State, and I'm sure that any organization, I know that Michigan State has trainers, and there are other state extension offices that also do have individuals on staff who are trained facilitators. Each state sets their own pricing. I know in our area right now, our mental health board received a grant, and they have been able to administer the course for free in our community, in our Tri-County area. Project Aware, many times for people who are working with youth, offers training for free, but most of the time, most instructors, the cost that you incur, you get back. So we buy the manuals, and then the people taking the course reimburse us for the manuals. So it's pretty much an even.
But they give you, on the website, you'll get a login, and they give you access to all of the PowerPoints, all of the handouts. There's handouts where you can put your own information on them, but it's still branded for mental health first aid. There's a lot of different resources on there, and there's also a lot of videos that go with the course, and all of those are provided to you on a flash drive and on the website as well. So once you receive the training to be an instructor, you're pretty much ready to turn around, and a couple weeks later you'll be ready to present the course.
Good, thank you. Are there other questions from the participants? I don't see anybody typing right now. It actually says somebody's typing when somebody's typing. Well, good. I really appreciate you pulling this together, Jamie and Amanda. Thanks for all the great information. For the participants, thank you very much for joining us. Again, we really appreciate your feedback. If you'll click on that link, you can provide some additional information about what you know, sort of the perceptions of the mental health first aid program. So that's very helpful. And I don't see anybody adding anything. For those who would like more information, you can contact us at the NCRCRD, or you can go straight to Jamie or Amanda, and they've provided their email in the chat box there. So with that, I think we'll close off for the afternoon, or at least on this webinar. We've got one more in about 20 minutes. So thanks again. We'll sign off.
Thank you.
Yeah. Bye.
Thanks.